Well, what makes Chicago, Chicago is like, I don't know, I just like the city life. I like the fastness of the city life. I don't even like the suburbs.
I'm Naomi Brown. I'm from Chicago, Illinois. When I found out that none of my teeth actually would be worth saving or going through more partials, I didn't feel good about myself. I kind of isolated from family and friends, and it kind of pulled me down, you know. I came up on Dr. Atcha. I just liked the way that he sat down and he explained everything to me. The other places, it was rush, and out. And then it was finance, you know, immediately. And so I made a decision, and I made it with Dr. Atcha.
I went to University of Illinois College of Dentistry, graduated in 1996, specifically in implantology and implant surgery, implant prosthetics, and I continue to better myself more and more because protocols changes, methods changes, materials change, and now especially now with the whole digital workflow with 3D printers and smile designs and so forth. Things have really changed and revolutionized, but you gotta have the proper formalized training, you gotta have certifications, you gotta have the fellowships, you gotta have the diplomats, you gotta have all that. You can't just go to a weekend course and learn how to place implants and come to your office and say, hey, I'm gonna give you a full mouth all on X and all on 4. It's not gonna work for the long term.
Founder and CEO Dr. Irfan Atcha joins us now. The first thing, doctor, I imagine when people come into your office is, doctor, I've been suffering for so long. Can you help me? And the answer generally is?
Yes, we can. Well, my belief is what we have out there, our social media, our before and after, our reviews, is reflective of who we are when the patients come in here. When they're coming to us and when they're letting us take care of their health and their mouth, believe me, they've done the research. They have read the reviews. Our patients snapshot their smiles of other patients, says, that's the smile I like. That's authenticity, that's realism, and that's something that's portrayed in who we are through how we communicate with our patients.
I just started looking around for, just researching the All-on-4, and that's how I found Dr. Atcha. I found him on YouTube, actually.
Who is the typical implant patient that you see?
People that have basically failing teeth, decayed teeth, they are in pain, they can't smile, they can't chew. Their self-esteem is impacted. They're hiding their smile when they talk to their friends and family. They don't think they have any hope available.
There were all these testimonials, all these pictures of, you know, people before and after. It was just crazy. The procedure really took 20, 30 years off their look. Everybody was like, you know, Dr. Atcha changed my life.
Wow. It's a great feeling of satisfaction because to impact somebody's life, to make it better, they're healthier, they're happier, they smile a lot more. It's a dynamic for not just the patient, but the entire patients and their loved ones, and everybody's benefiting from it. We get a lot of patients from our Chicagoland and the suburbs, Indiana, Wisconsin. We also get patients as far as California. We get patients from Florida, from Michigan, Ohio, Minnesota, as far as New York City.
I live in the suburbs of Syracuse, New York. I've had many years of different dental procedures done. I ended up with some sort of infection, and the doctors in Syracuse could not help me. And for months, I had no upper teeth. I could not eat. The doctor kinda said, maybe we should have done Zygomatic. I started going through the internet, just looking. What is Zygomatic? I came across New Teeth of Chicago and Dr. Atcha. And so I got my plane ticket and everything, and I told my husband it's probably something I'm never going to be able to do, but I'll go anyways. Dr. Atcha showed us what he could do, was very confident that it could be done. My husband was right there with me and was all for it because he knew how sad and how depressed I had become.
This is what was left of the bottom teeth were absolutely completely failing, but the upper teeth were completely gone. You know, putting the Zygomatics and giving you a full set of permanent teeth with Smile for us. This is not just surgery. We forget aesthetics and the support that patients want and desire.
Changes your life.
It does.
It provides us a lot of satisfaction and really reconnect those people to something that they've lost. What they lost? They lost their confidence. And we are so happy and grateful that we are part of reconnecting that for them.
Having a self-image, self-health, and taking care of oneself is very important. It kind of flows into a lot of other areas of your dynamics, whether it's your work environment, your patients. I'm a runner, I box. I like doing things that are very high energy, that relaxes me. If I can perform the best for my patients and give it what I've been trained for, I always believe if you take care of yourself, you can take care of others as well.